Here's the health news other creators aren't talking about. DaVita, the company that operates over 2,600 dialysis centers across the nation, was hit by a ransomware attack. DaVita said that on Monday, April 14th, the operations were being affected, but they did not disclose how its operations were being affected or how long the disruption will last. DaVita has not said whether or not patient records were accessed at this time. United Healthcare shares crashed after a surprise earnings missed on Thursday, April 17th. Shares fell over 20%, set for the biggest fall in over 26 years. The reasons they gave were a lower outlook miss due to higher medical costs and that Medicare Advantage demands exceeded United Healthcare's expectations. Next up, this caught my attention. CT scans in a single year could result in 100,000 future cancers in the United States. They could be responsible for approximately 5% of cancers diagnosed each year. This is concerning to me, but not surprising given the fact that several weeks ago, I actually did a story on the fact that the radiation that is emitted from CT scanners is actually not consistent across scanners, even though it is supposed to be, which could subject patients to a lot larger dose of radiation. So a risk model suggested that CT scans in 2023 were projected to lead to over 100,000 future cancers over the lifetime of exposed patients. And that if the radiation doses remain unchanged in future decades, they could be responsible for approximately 5% of cancers diagnosed annually. In great news for the world, the first global pandemic treaty was agreed to through the WHO. For the United States, not so great because we're not included. For the first time, nations have agreed to a series of measures to prevent and prepare for and respond to pandemics. The terms are still being hashed out, but this is a definitive moment in the history of global health. Unfortunately, this was agreed to without the United States because President Trump has withdrawn the United States from the WHO. This one definitely caught my attention when I read it. Lab-grown teeth might become an alternative to fillings following a research breakthrough at King's College London. King's College London apparently has been working on this for more than a decade. They say that unlike implants and fillings, which are fixed and cannot adapt over time, a lab-grown tooth made from a patient's own cells could integrate seamlessly into the jaw and repair itself like a natural tooth. In their latest study, they made a key discovery on the environment needed to grow teeth in the lab. They've successfully introduced a special type of material that enables cells to communicate between each other. So this means that one cell can effectively tell another one to start differentiating into a tooth cell. So this mimics the environment of growing teeth and allows scientists to recreate the process of tooth development in the lab. Huge step forward. Would definitely love lab-grown teeth. That's it for this week. See you next week.